So looking at the increasing number of cases everywhere, how do we continue maintaining essential health services, especially as the health system is totally overwhelmed?
Yeah, I think that's very important because right now we see that people who have chronic diseases are not getting as much care as they should because everyone is afraid of going to the hospitals. I think that it has to be a partnership right now. All the stakeholders have to be involved, including the hospitals. Most hospitals have to be open, stocked up with medications to manage other chronic diseases. And like you said, because people are not getting as much care as they should. So if it means partnering with the private sector, because right now, let's bring it back home. In Nigeria, the private sector is highly responsible for healthcare. Partnering with them, if it means having them have a little bit of isolation or one-room isolation centers, trainings are important. So at this time, staff has to be trained, management, detection, knowing symptoms or seeing symptoms on time. So I think these things have to be implemented to have other people get access to care. The diabetic patients, the hypertensive patients, the HIV patients. There's this, what I call it, burden right now that a lot of people who are actually dying are also chronic patients, chronic disease patients that are not getting access to care as they usually would before the COVID-19 pandemic.
So you say now the healthcare system should be taken over, or the private sector at least should come and partner with the government to ensure that the healthcare system is strengthened. But of course, the private sector is also overburdened by all of this. Of course, looking at the fact that a lot of people, especially in different strata, have not been going about their businesses. How will the private sector be able to cope?
Yes, it's true, and it's not a Nigerian burden. It's a burden all over, and that's why at the beginning I talked about the government. We need help. We need a collaboration, not just the government, other stakeholders. We need more investment in the healthcare system right now to even cushion the effect on the private hospitals or the private healthcare providers. You know, I think with more investment, more training, more support from the government, you know, I think that it would help the private sector come up a bit in bringing up about care for the masses and take away most of the burden that they're experiencing now. The burden is much on the private sector because they're alone, and that's why I talked about partnership. They're having to struggle with this alone. So if we have partnership, if we have help, if we have strategies between the government and the private hospitals or the private healthcare providers, it will cushion the effect. I am sure it will cushion the effect.
All right, now, as a public health experts now, how do we achieve the sustainable development goals as regards as regards public health in this period of COVID-19, where everything is on a standstill, the health system is highly it's in a situation whereby the system is quite overwhelmed. How do we achieve the SDGs as regards public health?
Yeah, it still goes back to the question you asked earlier. To keep the standards or to maintain the plan of the SDG for the UN nations, I think we still have to go back to prioritizing healthcare. I mean, SDG goals do not they affect different sectors. At this point in time, I think this is a bell for us to now come back home and focus. The COVID-19 experience has been a siren for us to come back to the health system, to SDG goals as regards the healthcare system. What were the things we were supposed to do initially? Invest in the healthcare system. We need investment. We need support. Invest in research. You know, those were the things those are the things that the SDG goals actually focused on. So, I mean, as much as it's bad, I think that is a siren because, you know, the question you asked about the effect that the private sector is experiencing now, If these things have been focused on from the beginning, I think it wouldn't have been as bad as we're seeing it now. Support finance-wise, support research-wise, in every way we can now put the touchlight on the healthcare system, on management of diseases. And I mean, SDG goals even included other maternal health and other things prior to now.
Yes,
So
true.
this is the time to, go back to the SDG goals and do the needful, to make sure that we are focusing on what to be done. We are focusing on helping the healthcare or shining this light on the healthcare system.
Well, public health experts, Dr. Yemisi Soyombo, thank you so much for talking to us.